Klor-Con M20 is a mineral supplement that is used to treat or prevent low levels of potassium in the blood. Potassium is important for the proper functioning of your cells, kidneys, heart, muscles, and nerves. It is usually obtained through a well-balanced diet, but certain conditions such as severe prolonged diarrhea and vomiting, hormone problems like hyperaldosteronism, or treatment with diuretics can lower your body's potassium levels. It is important to take this medication as prescribed by your doctor to maintain a normal level of potassium in your blood. The daily dosage and optimal timing for taking Klor-Con M20 will be determined by your healthcare provider based on your individual needs. When taking Klor-Con M20, it's important to follow your doctor's instructions. To avoid stomach upset, take each dose with a meal and a full glass of water, unless your doctor tells you otherwise. After taking the medication, wait at least 10 minutes before lying down. Do not crush, chew, or suck on the tablets, as this can increase the risk of side effects. If you have difficulty swallowing the tablets, you can break them in half and take each half with a glass of water, or dissolve the tablet in water before taking it. Take Klor-Con M20 regularly at the same time each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so do not increase your dose or take it more often than prescribed. Do not take more than 20 milliequivalents per dose. If your condition does not improve or if you experience symptoms of low potassium in the blood, such as irregular heartbeat or muscle weakness, be sure to consult your doctor. If you experience upset stomach, nausea, vomiting, gas, or diarrhea while taking Klor-Con M20, it's important to tell your doctor or pharmacist. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to seek medical help if you have difficulty swallowing, feel like the tablet is stuck in your throat, vomit that looks like coffee grounds, stomach/abdominal pain, black/tarry stools, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects, be sure to contact your doctor or pharmacist. And always follow the guidance of your healthcare provider regarding the daily dosage and optimal timing for taking Klor-Con M20. Before taking Klor-Con M20, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Let your pharmacist know if you have any concerns. It's also important to discuss your medical history with your doctor or pharmacist before using Klor-Con M20, especially if you have heart problems, kidney problems, or high levels of potassium in your blood. Due to rare reports of stomach and intestinal ulcers and bleeding with sustained-release potassium products, it's recommended to take a liquid form of potassium instead. If you have throat, stomach, or intestinal problems such as blockage, narrowing, or ulcers, be sure to let your doctor or pharmacist know. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you're considering using other potassium supplements or salt substitutes that contain potassium, it's important to consult your doctor or pharmacist first. Too much potassium can cause serious side effects, so it's important to be cautious. If you're pregnant, Klor-Con M20 should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor before taking this medication. And if you're breastfeeding, it's important to consult your doctor before using Klor-Con M20, as potassium can pass into breast milk. Be sure to have this discussion before making any decisions regarding breastfeeding while taking this medication. It's important to be aware of potential drug interactions that could affect how Klor-Con M20 works or increase the risk of serious side effects. Make sure to inform your doctor or pharmacist of all the medications, including prescription, over-the-counter, and herbal products, that you are currently using. If you are taking other medications that can raise your potassium level, such as drospirenone, eplerenone, ACE inhibitors, angiotensin receptor blockers, or potassium-sparing diuretics, it's important to let your doctor or pharmacist know. Additionally, if you are taking medications that can slow down the movement of potassium in your stomach or intestines, such as atropine, scopolamine, antihistamines, antispasmodic drugs, bladder control drugs, or certain drugs for Parkinson's disease, it's important to inform your healthcare provider. This is because they could potentially increase the risk of side effects. It's essential to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. And always remember to take Klor-Con M20 as directed by your healthcare provider, and to ask them about the best time to take it and the appropriate daily dosage for your condition. If someone has taken too much Klor-Con M20 and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 or a poison control center immediately. Symptoms of an overdose may include irregular heartbeat, muscle weakness, and confusion. If you are a U.S. resident, you can call your local poison control center at 1-800-222-1222. If you are a Canadian resident, you can call a provincial poison control center for assistance. It's important not to share Klor-Con M20 with others. While taking this medication, you may need to have lab or medical tests to monitor your potassium blood level and kidney function. It's important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Klor-Con M20, it's important to maintain a well-balanced diet. Foods high in potassium include bananas, oranges, cantaloupe, raisins, dates, prunes, avocados, apricots, beans, broccoli, spinach, potatoes, lentils, chicken, turkey, beef, and yogurt. Consult your doctor or dietitian for recommended foods. Remember to take your medication as directed and at the same time each day for the best results. If you forget to take a dose of Klor-Con M20, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store Klor-Con M20 at room temperature, away from light and moisture, but not in the bathroom. Always keep it out of reach of children and pets. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it is expired or no longer needed, and if you're unsure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.